Hello guys, welcome back to my channel Inspired by Leah. So how have you been doing today? I hope you guys have a great day ahead. So today I'm going to talk to you in the topic of let's talk diseases. It's about PCOS. So many do not know what is the meaning of PCOS or what is it about PCOS. So let's break down PCOS in 6 parts of it. So the first part is what it is about PCOS or what is PCOS. So PCOS is polycystic ovarian syndrome. So polycystic ovarian syndrome is mainly affected women. It's actually imbalance of hormones in women's ovary. So basically women have 3 hormones, which is testosterone, progesterone and estrogen. Well, anyhow, you heard it correct. It is testosterone. But testosterone in a woman basically is only a very low level of testosterone in a woman's body. But in this case of PCOS, level of testosterone is way much higher than it should be. Part number 2. Who has PCOS? So PCOS is only affected women. It doesn't matter a woman to be a fat, slimmer or lean woman or a obese woman. Women who already have PCOS, they will know that their menses are starting to be irregular. So that's when you will know that you have PCOS. But to confirm and diagnose PCOS, you have to go to hospital and check on it. Part number 3. When does PCOS happen? Women in their age of puberty age, means like in minimum age of 15, and a menopausal minimum age is 44. So during this time only you may realize that you have a PCOS. So obviously PCOS happens before menopausal age. But when a woman found out that they almost reach in the age of 20ish to 30ish, is when the menses will start to be irregular or prolonged menses. So in this age 20 to 30, these women may have already married. So at this stage, they may realize that it's difficult to conceive a child. So this is when they will step another further option, is whereby they will visit a doctor. And then they will realize they have a PCOS by a ultrasound scanning or vaginal scanning. Part number 4. Where does PCOS happen? So by now you should know PCOS means it happens within the name itself. So P means poly. Poly means a lot, multiple, many. C means cystic. Cystic is like a blister, whereby a fluid inside a blister or membrane sac, which can be grown further and further. Ovarian means ovary. So basically in a woman, there is 2 ovary. One is on the right and one is on the left. Syndrome means collection of certain signs and symptoms that concludes to a health condition. So basically in a simple term means that a blister that it is formed in the ovary, which can grow bigger and bigger. It may rupture or it may not be ruptured. It may be benign or cancerous. Part number 5. Why PCOS? I'm sure every woman out there who have been already diagnosed as PCOS will ask this question. Why do I have PCOS? Well girls, do not worry and do not be frustrated because of PCOS. Eventually, if you take action, PCOS can be healed. Alright guys, so be relaxed and take it easy on yourself. So actually PCOS is an imbalance of hormones. So like I say, women have 3 hormones: progesterone, estrogen and testosterone. So these hormones are imbalanced. Each hormone play each role in the woman's body, specifically in the ovary. There are several medical conditions that leads to PCOS, such as hypothyroidism, insulin resistance, adrenal fatigue, inflammation of the cells, or post-birth control pills. Number 6. How is PCOS formed? Well, I will show you in a diagram format and explain to you how PCOS formed.
So this is the diagram that I was talking to you about of how does PCOS form. So pituitary gland is inside the brain. It's a very small pea size of gland which play a major role into our vital body functions and also controls our well-being. So one of it produces luteinizing hormone and follicle stimulating hormone. So both of these hormone plays a part to send signal simultaneously to both sides of our ovary to grow and produce ovum. Eventually, ovary will produce three types of hormones, which is estrogen, progesterone, and testosterone. So in a normal woman, all these three hormones will be very balanced. But in PCOS woman, all of these hormones are imbalanced. So let's see. Estrogen is to produce egg. It also helps to regulate menstrual cycle, growth of uterus lining, and high level of estrogen stops luteinizing hormone and increase follicle stimulating hormone, whereby it will help progesterone to release matured egg, and progesterone also play a part to thicken up uterus wall to receive fertilized egg. So if a woman does not have a fertilized egg, then the uterus wall will shed off, which is why we call it as period or menses. Ovary and adrenal glands produce testosterone minimally, and it will be released into blood. And testosterone's function is for growth and maintenance of female reproductive tissue and also bone mass. In a case whereby a PCOS woman have insulin resistance, high level of insulin will produce testosterone, and it also will be released into bloodstream. That is why some of female with PCOS have masculine body and a very hairy face or body. Existing high level of luteinizing hormone due to low level of estrogen, whereby it will stop produce egg or inhibit to an egg in becoming mature. So eventually, immature egg will stack up inside ovary. That is why it called it cystic ovary. So existing high level of luteinizing hormone, which also produce or increase testosterone levels, also it will release into the bloodstream, whereby our brain pituitary gland will not produce follicle stimulating hormone or luteinizing hormone because the existing high level of luteinizing hormone. Therefore, an ovulation will happen. An ovulation means there will be no ovulation take place due to imbalance of all these hormones. Some women with PCOS may face no period for about 1 month or 2 months or even a year. So guys, this is how PCOS is formed.
So guys, if you like my channel, do subscribe to my channel. If you like to share these messages to your friends, do share in any of your social media and click the bell icon so that you will get notified each every time that I upload my video. Guys, if you have any disease that you want to talk about or you want me to share in the YouTube channel, do comment below. So guys, I will see you in my second part of PCOS in the topic of Let's Talk Diseases.